confirm what are the ways to build this European Health Union.
And thanks very much also to my speakers in this roundtable for waiting around. Of course, with that many speakers, it was to be expected that we would be a bit delayed. So many thanks for that. But fascinating discussions, and I'm sure with this roundtable we will add to that. Just very shortly to myself, just I will go with Ole Peter and really cut my introduction short. The European Health Forum Gastein facilitates also the European Health Union initiative, and I've actually circulated the manifesto in the chat. And the initiative published this manifesto last year, and in it welcomes the Commission's plans for a European Health Union, but it calls for a much more ambitious and less reactive version. So one that doesn't mainly focus on emergency preparedness and response, but it considers also long-term goals to build and support resilient health systems and societies. And Giuseppe mentioned in his talk today that we have seen positive steps like the joint procurement for vaccines, but a lot of the big goals still need to be ambitiously worked towards. And if you would ask anybody from the initiative, and probably also many more experts in the field, what is needed on the way to this new model, they would probably answer a treaty change. Because a treaty change is finally needed to challenge the current division of powers and to benefit from acting together in health. So it may sound a bit strange, but giving more power to the EU would in the end enhance the power of member states. And I think this is something that this message has not really arrived at policymakers. So just to cut it very short, some of these longer term asks of the initiative will be addressed by our speakers today, like an inclusive approach to health and societies, burning health workforce issues, and digital transformation, and also European health research. So I won't keep us any longer. Edwige, would you like to come in?
Yes, perfect, Dorli. Thank you for this introduction. And, nous allons avoir notre premier speaker de cette troisième table ronde, c'est Gunhild.
Indeed, the first speaker is Gunhild WALDEMAR.
Président de BioMed Alliance, c'est ça?
Yes.
She's the president of BioMed Alliance.
At the University of Copenhagen, and she's also the president of BioMed, the BioMed Alliance, which is an association of leading European medical societies comprised of researchers and health professionals. So we look forward to hearing your recommendations for a European Health Union. Gunhild, over to you.
Thank you very much. It's a pleasure for me to contribute on that behalf of the Biomedical Alliance to this very, very important agenda of building a European Health Union, an agenda that we support fully. And we are a trusted body representing the health and biomedical research community. And it is our mission to promote excellence in European biomedical research and translation for the benefit of patients and for European citizens. We strongly support the development of the European health issues, but certain key issues need to be solved. Next slide, please. Among those, we believe that European is falling behind in health innovation compared to some global counterparts. While we actually have many skilled and dedicated people across disciplines and sectors who could contribute even more to health innovation. We have an insufficient European coordination in cross-border health and research, something that has been touched upon already by previous speakers. And there's a lack of synergies between different EU health research mechanisms and national priorities. Also, we feel that stakeholders and healthcare professionals are not involved early enough in the development process of the EU health initiative. And they also, our researchers and healthcare professionals meet unnecessary regulatory complexity, which are barriers to their work. And these are issues that we have been working on for several years already. Next slide. And next slide, please. Yeah. And briefly spoken, what we recommend is for improvements in health for European citizens to be science-led, and for a stronger coordination. So first of all, we need a more ambitious and visionary leadership responding to the needs of citizens. This has been also talked about by many of the previous speakers. We need also to provide training to our citizens and healthcare professionals so that they can much more effectively participate in relevant initiatives. And we need involvement of stakeholders, EU citizens and the scientific community from cross-disciplinary fields. In fact, we need them to also be able to take a lead. And we need to align different legislative approaches with a clear and enabling EU legal framework. And perhaps most importantly, we need to ensure that health improvements in global health and for our European citizens and patients needs to be science-led. And we need to, for this to happen, actually, we need to develop or to evaluate the landscape of health research instruments, and to also explore the need for even stronger and more coordinating structures, such as the European Council for Health Research that has already been talked about by Karen Cepito and others. Thank you for your attention.
Thank you, Gunhild WALDEMAR. Dorli, nous passons
Thank you, Gunhild WALDEMAR. Dorli, let's move on to the next speaker. And we're welcoming Peiling. Yeah.
The International Digital Health and AI Research Collaborative in Geneva. And Peiling, if you could please share with us your recommendations for an inclusive and sustainable transformation of healthcare and research systems. Thank you.
Thank you very much, Dorli, and thank you for the invitation. It's my pleasure to share this space with you. So my main recommendation will be for the European Health Union to really invest in the digital transformation of healthcare and research systems in an open, inclusive, and sustainable manner. So one of the most fundamental investment would be to build transdisciplinary communities in the health workforce, as well as the R&D sector, so that the development and employment of digital health technologies, including AI, can be done collaboratively. Here, we can look to have innovative learning platforms and curriculum which can bridge different communities of practice. And for longer-term sustainability, we can establish distributed research infrastructure to allow for hands-on practice, as well as open and trusted collaboration. An essential ingredient in building effective digital health technologies is high quality data. So big data alone can be of little value in the health domain. And therefore we need to have data platforms that can actually annotate, maintain, share, and also permit use of data for health in fair and responsible ways. Here we need to have novel approaches to data collection and reuse, and also ways to share value derived from data fairly across all stakeholders. In terms of secondary use of data, I think we can look at the Swedish National Data Service as an example, where together with a network of around 40 universities and public research institutes, they strive to create a national infrastructure for open access and reuse of research data. So the goal is to make data as open as possible, as close as necessary. Another point on data is diversity in data is needed so that the platform should enable pooling of data power without aggregating data. Another crucial investment would be to build a neutral escrow for digital public goods for health. These public goods would be open source software, models, and standards, allowing for countries to adapt, adopt, and scale their digital public health infrastructure based on their needs and means. Again, here we can learn from Estonia's achievements in the development of digital public services and their push for digital public goods. It is important to note that the role of this escrow should not simply be a repository, but it has to play the role in maintaining these public goods, as well as aggregating and sharing the learning and knowledge generated from the practical use of these public goods. A lot of digital health solutions have emerged over the past years, particularly during the current pandemic. However, their true effectiveness remains debatable. So one way to temper this rush to digital health solutions is to bring more emphasis to research systems, which would allow for inclusive and demand-driven solution making. So there are two research areas that we think could potentially make a difference. First, distributed clinical trials where AI can help create and manage global clinical cohorts and bring scale and diversity to data and outcomes. And second, participatory public health approaches with citizen scientists helping to prevent and manage infectious disease outbreaks or patients prone to non-communicable diseases, improving public health outcomes. The final suggestion would be to set up a robust governance mechanism for data and digital technologies. The mechanism should have a data protection and security core and allow for a shift from command and control to connect and cooperate. It is also key to bring in the patient voices in the assessment of the healthcare interventions. Finally, one last point is health and diseases really know no borders, and therefore it is important to build on and invest in the above points that I've just mentioned in a collaborative and respectful manner with other countries and regions, particularly the LMICs. Thank you very much for your attention.
Thank you, Peiling. Le prochain speaker, Dorli, je vous laisse le présenter.
Next speaker, thank you, Peiling, is
Thank you. Freek is the director of FEANTSA,
Freek.
The European Federation of National Organizations. And Freek will offer some recommendations on an inclusive European health union from a health democracy point of view and the urgent need for cooperation in order to tackle health inequalities. Over to you, Freek.
Thank you, Dorli, and good afternoon, all. For the sake of time, I'll try to be short and sharp. I have 4 recommendations for you. The first one, if we want to have an inclusive European Health Union, is that we need to have and reserve an important role for organized civil society as a key partner of the European Union to deliver impact on the ground. And this is not only at national level, but also at European level. And I want to emphasize in this connection the importance of funding for these organizations to operate also at European level because they bring expertise and in a large network and an easy link to grassroots organizations and the reality on the ground. So the first recommendation is make sure that organized civil society can play its role in the European Health Union. The second recommendation is to make fighting health inequalities a top priority of the European Health Union. I know that in current policies, it is mentioned here and there, health inequalities is mentioned, the EU for Health program, but not really as a major issue of concern, and certainly not as a distinct issue of concern. It gets mainstreamed, and that's good, but sometimes mainstreaming, or sometimes there is a risk that things get mainstreamed into oblivion, and we have to make sure that that doesn't happen here, so that it is a separate, distinct, important priority to address health inequalities. And in that connection, I think it's important to have a slightly more sophisticated understanding of what the social determinants of health are and how to address them. And I cannot go into much detail here, but I would make a plea here for more attention to access to quality housing as an effective health intervention. I often see that housing drops off the list of social determinants of health too easily. So the pandemic has showed us how important housing is as a public health intervention. Let's build on that and put some more emphasis on that in work on health inequalities in the framework of the European Health Union. The third recommendation that I would like to make is if we want to reach the vulnerable parts of the population, and that seems to be the objective, we need to really strengthen cooperation between health and social care sectors, break the barriers or the walls that still exist to some extent between those two sectors. The pandemic has shown us the disconnect between both sectors and how important social care providers are as public health actors. I think the health sector needs to know more about social problems, and the social care sector needs to know more and act more on health issues. I think that's also true at EU level. I think inside the European Commission, for instance, DG Health and DG Employment could work more closely together. There is many reasons to do that and many opportunities. And maybe also the EPSCO Council, where health minister and social affairs ministers often meet separately. Why not make them meet together from time to time on overlapping issues? And the last recommendation I would like to make is we often say that we don't want to leave anybody behind, that we want to reach all people. I think if we say that, we have to be aware of what we're actually promising, and we need therefore to take specific action to reach the most marginalized communities that also exist, who are also a reality in the European Union of today. I'm talking about homeless people, prisoners, undocumented migrants, etc., etc. And they often get overlooked, not on purpose, but because people don't realize how important and how big these very marginal communities are. Just to give you the example of homelessness, we estimate that on any given day in the European Union, there is at least 700,000 people that are sleeping on the street or in a homeless emergency shelter. So let's make sure that we reach them. And just to give you one example, the important Beating Cancer Plan, for instance, has just launched the Inequalities Register. If I look at the Inequalities Register, which still needs to be further developed, it excludes by its nature some of these communities like homeless people, because they're not captured by the survey methodology that is being used. So these are my 4 quick recommendations. Thank you, Dorli.
Merci d'avoir été si concis, Freek, et on entend cette volonté.
Thank you very much for your very concise presentation, and thank you for those 4 recommendations. Let's indeed not forget vulnerable communities. Dorli, the next guest is Catherine PAJARES-Sanchez.
Social and Environmental Council, and she will explain to us today why, from the Council's point of view, the EU must make health a priority, and she points to European values. So we look forward to hearing from you, Catherine.
Tout d'abord, bonjour à toutes et à tous. Merci d'accueillir.
Thank you very much for your invitation. Thank you for inviting the National Council for Economy, Social and Environment. We expect a lot in terms of health. 60% of European citizens wish for the European Union to acquire more competences. On the other hand, almost half of the citizens think that the EU did great during the pandemic. So our council thinks that this is the right time to move on and to move forward to meet the European citizens' expectations and needs. As far as we're concerned, we need to answer their needs and show the citizens that Europe can be efficient and bring well-being on a daily basis. Consequently, building a European health union is an ambitious economic and social objective that will put Europe on a springboard. I can only share with you the different themes. First and foremost, how to build a common European health framework based on values and European commitments. Therefore, working efficiently on the right to health. Secondly, how to meet society's expectations. This democracy should answer civil society's expectations when it comes to health policies building and expectations. And then how to build an inclusive health model that should erase the disparities between member states to make sure that there is a central health access. And lastly, how to reinforce the weight of the European Union on the world health stage. To answer those questions, there are indeed challenges. Those are political challenges, how to reinforce health in Europe without rewriting the treaties, and we will make pragmatic recommendations. And then with regards to governance, the Commission thinks that at the highest level, the load should be shared, and there is a research challenge, which is to go beyond the budget effort. The question is who to support. And then there's an industrial challenge. It's a strategic market for health, and we need to know how to secure purchases and reinforce the supply chain that whose weaknesses were highlighted during the pandemic. Building a European Health Union also challenges the use of data. The creation of a European health data center is paramount. We therefore need to address the mental health issues as well, and the EU is thousands of workers, and we think that health at work are not necessarily dealt with at the European level. Our concrete and operational presentations will be presented on April 12. It will be broadcast live, and we invite you to watch us or to log in to hear our very concrete proposals sent to the European Commission and the French government. Thank you, Catherine. Our last guest is Marion Lelouvier.
So I just have three.
Marion, est-ce que Marion, vous êtes là? Qui est-ce qu'on entend? Non, c'était peut-être. Alors, qui est-ce qui parle là?
Okay, we're hearing several people on the line. I can see that Marion is waiting patiently. Okay, you're the General Secretary of the Fondation de l'Avenir.
Thanks for handing over. There were some technical issues there for a second. Sorry about that. So Marion, we would be really interested in hearing from you about the Foundation's recommendations on the health workforce issues in Europe. Thank you.
Merci à vous. C'est un grand honneur et un grand plaisir pour moi d'être avec vous cet après-midi. Effectivement,
Great honor and pleasure to be here with you. I represent the Fondation de l'Avenir. We have helped thousands of research teams over the last 35 years. We helped surgeons, doctors, nurses, engineers in France and abroad. It's a public need foundation, and we actually help other foundations. We are the umbrella foundation of other smaller foundations. Indeed, health is linked to public policy, and in order to avoid illnesses, prevention is key, but to cure people, health initiatives exist. However, a lot of European citizens live far away from health providers. So we need to find a solution to this equation and to organize things as efficiently as possible. We would like to start from a blank sheet and make sure that there are no longer individual providers and make sure that everybody can work within a network in a pluridisciplinary clinic or within a network with digital help in isolated territories. Approach to task delegation is the following. There are different reports, and we have been working on this quite a lot. And obviously, multidisciplinarity is a factor of success. Health networks should be regional, national, and international, at least European, in order to benefit from solidarity while taking into account ethic and solidarity issues. For this organization to organize, training of health professionals is important, and I would like to praise the invitation that was extended to students. It is important. We offer grants to students, we help researchers, and sharing knowledge is important. And this is the only way we will move on and improve health issues. We recommend training standards and equivalence for the initial training as well as in-service training. We want health professionals to be able to move from one region to another, from one country to another, and it is important to offer the possibility to private players to work with public players so that altogether they can think about the different challenges. Obviously, training is a recognition tool, and the rights recognition is also paramount. It unfortunately is not always respected because sometimes there are quite a few instances of violence towards health professionals, sometimes coming from the patients because it is difficult, but they can also come from the system itself because, for example, we were not able to protect health providers from sexism, and also from the liberty they should have to act as health professionals. So this is something where solidarity should be paramount. Thank you, Marion Lelouvier. And with regards to training and students, I would like to yield the floor to Soyu Nang from Utrecht University. She comes from the Netherlands.
Okay, perfect. He
comes from the Netherlands.
I know everyone's really tired. So my message is that, as someone who came from the outside of Europe, in my case from Myanmar or Burma, to study infectious disease and Gunhild to come to Europe through the support of European Union Erasmus Mundus program, I would like to make two recommendations based on my experience of living and also witnessing different aspects of European healthcare system in the countries I live, that include France, Spain, Scotland, and the Netherlands. So during this Erasmus Mobility Program, we have this research interest in understanding how antimicrobial resistance is understood and aware among our politicians and policymakers in Europe. So through my collaboration with my colleagues from the Netherlands, France, Spain, also Myanmar, we were able to identify some key findings that include knowledge gap area and also what strategies work best for EU or not. This sort of collaboration among young professionals and students should be more promoted. That could be more beneficial, not only for EU, but also for non-EU regions. So my first call to action is to inform and convince our politicians and policymakers across Europe regarding the status of present One Health issues such as antimicrobial resistance, which is referred to as the next pandemic. So based on our research findings, we need to emphasize more work on promoting knowledge, awareness, and perception of such issues among our political leaders. And secondly, we know that a lot of health problems are related to human behavior, and knowledge is not always equal to behavior. We have a knowledge, but sometimes we just do not follow it. So I believe that effective interventions targeting behavioral change to promote well-being of citizens are one of the great ways to empower the European Health Union. So this concludes my recommendations.
Thank you very much. Dorli, nous vous retrouvons pour conclure cette troisième.
Okay, Dorli, would you like to close this roundtable? What were the different recommendations made?
I've been taking notes, and I realize we have a very rich and colorful portfolio of recommendations here. And it shows us one thing clearly, again, there's lots to do to build a European health union that serves all. So we went from Gunhild's presentation showcasing a lack of health innovation and coordination in research, and a clear call to listen to the needs of citizens, which is also something that Katrin was saying. We need to listen to citizens and their expectations. And Gunhild also pointed to the fact that science in general needs to be listened to more. And Peiling took that up from there to call for a transdisciplinary health workforce and research and development environment, which is something that other colleagues have already mentioned today too, and to go towards building fair and responsible data platforms. And Peiling also had a very interesting quote that I put down. She said, let's go from command and control to connect and cooperate. I think that's something we could each put on our portfolios. Thanks for that, Peiling. Freek then passionately pointed to the necessity of health and social care sectors working together in order to make the fight against inequalities in health a top priority. And he also urged for organized civil society organizations to be seen as key partners by the Commission. And Catherine then was saying that we needed to strengthen the EU's role in global health and also to level disparities between member states. And she also pointed to the challenges that these goals entail, like the much needed emphasis on prevention. And Catherine also called for a European Health Data Center. Marion then addressed the health workforce challenges that were laid bare by the pandemic and the unequal distribution of health workforce in Europe, and also to look out for the rights of health workforce professionals. And she also pointed to the necessity of working within networks, both regional, national, but also beyond that on an international level. And then it was very nice to hear Soyuz's point of view, the young voice. He pointed to on the one hand, to the silent pandemic that is upcoming. We all know about it, but somehow we don't seem to be doing much about it, and that is AMR. And then Soyuz also believes that there's a need to target behavioral changes to promote the well-being of citizens. So that's in a nutshell from my side. As I said, a very rich discussion on this roundtable. Thank you very much.